So this is the regular council meeting of Monday, September 26, 2022. It is 6:01 and I'm calling the meeting to order. This meeting is going to be recorded on Zoom and it will also be visible by link on our website after we post the meetings. So the first item is the adoption of the minutes. There's two sets of minutes to adopt: the Governance and Operations Committee meeting of August 15th, 2022, and the regular council meeting of August 15th, 2022. The recommendation is that both these sets of minutes be adopted as circulated. Do I have a councillor to make that motion?
So moved.
Councillor Jones, thank you. Do I have someone to second that motion? Councillor Butler, thank you. Does anyone see any errors or omissions in the minutes as presented? Seeing none. Okay, all in favor?
Aye.
Carried. Thank you. Okay, so item number 2 is public question period. There is a recommendation that the order of proceedings and business be adjusted to include the public question period under items 3.1 and 3.2 respectively. Do I have someone from council to make that motion? Councillor Dobie, thank you very much. Do I have someone to second that? Councillor Butler, thank you very much. All in favor? Carried unanimously. Thank you. Okay, item number 3 is communications. I think I should just probably ask at this point, is anyone that is up in the gallery, is anyone here that wants to speak about something other than the shelter and homelessness permit?
Not seeing any hands up here.
Okay, and there's 41 attendees online, so it's a little tricky. Maybe you can put, let us know if there's something else other than the shelter permit that you want to speak about. Now, Ms. Lucchini, remind me, was it people who were attendees last time, they didn't have access to chat, right?
That's correct.
So how were they notifying us if they wanted to speak?
You could ask them to email my DCA email.
Your City of Trail email. Okay, great. Okay, so at this point, if there's anyone that is an attendee on the on Zoom who is here to speak about something other than the shelter, I would like you to email Sandy Lucchini. And Sandy, can you please say the email, please?
It's dca@trail.ca. That's dog, cat, apple @trail.ca.
That stands for Deputy Corporate Administrator. Okay, so I'll just let that sit for a minute. Okay, so we're on item number 3. This is communications around 1456 Bay Avenue. Application for renewal of temporary use permit. I see we have 47 people online. We have quite a few in the gallery as well. How we are going to do this tonight is I'm going to hand it over very shortly to our CAO, Colin McClure. He is going to give an update. Then we are going to turn it over to Interior Health, BC Housing, and Trail Association for Community Living. They are our 3 service providers to give any updates since we had our last meeting. A delegation from Trail was also down at the UBCM, and we had great minister meetings with staff as well as ministers, and we think we've potentially moved this forward. So at this point, Mr. McClure, I think I will turn the floor over to you to give an introduction.
Thank you, Your Worship, and thank you to all who are joining us in the gallery today and those that are online. We know on this particular agenda item that from the last meeting, we heard from not only people attending, but from the letters that we received afterwards, both for and against the shelter. One of the main proponents is, of course, of it being in the downtown. We took that back, and we've been working with IH, and we've been working with BC Housing, as well as the Mayor noted. We were down for a week-long meetings with ministers at UBCM, and we had a number of meetings and believe that we've had some good success. I don't know how many today actually read the report that has been created for this particular agenda item. It's different than the last time. And firstly, I'm going to allow for people to understand that what we've decided to do is move the question period from before until after we've gone through this particular staff report and an update from BC Housing and IH for sure. And then we will allow council to have any questions that they might want to have and clarifications. And then if there is interest from the public to speak, we will allow it. A couple of things to be clear of. If you're just here to say that it's a problem down there, we already know that. So please don't take up time with that sort of conversations. We understand that we're doing the best we can to work with it. If you've got something new to add that is not answered through the presentation today, that would be something that we would want to hear from you for. But otherwise, we're really hoping that as council heard from the community that we've got some resolutions here. They're going to take some time, and take some patience from the community, but that you would allow the report and the reporting out to hopefully answer any questions that you might have. The other part that I would just really want to make clear that if any of you here today that are wanting to address council, that are running for council, that you don't use this as an opportunity to kind of put your platform on. But just again, we're here. We're glad that people are present today. I understand it's a very challenging issue, and we're seeing that from the turnout today, both here and online. So for me tonight, Your Worship, I'd like to pass it over to BC Housing to kind of give not only council an update, but those that are here in the gallery. And we have Tyler Baker from BC Housing, and we have Nanette Robot as well. And so please, Tyler, if you want to step in, that would be great.
Thank you, Colin. Thank you, Mayor and Council. Am I able to share a presentation, Sandy?
Yes.
Oh, okay, sorry. It is there. That's where it should be. Okay, so thank you. As Colin said, we are very much aware that this is a charged issue for the community, and we're very grateful to be back here to talk to you again. I'm Tyler Baker. I'm the Director of Development for the Interior Region at BC Housing, and I have my colleague Nanette Robot here as well, who's the Director on Operations for the Interior Region. Just a quick land acknowledgement. BC Housing acknowledges that we live and work on the unceded ancestral territories of hundreds of Indigenous peoples and nations across British Columbia, each with their own unique traditions, history, and culture. Okay, so the option presented today in council, as Colin mentioned, is for a 1-year extension rather than a 3-year extension. The two main things that we'll be speaking about today are why we've reduced the request to 1 year, and the impact of council if council chooses not to extend the permit at all. So if the temporary use permit, or the TUP here as the acronym is extended, the shelter would continue until September of 2023. If it's not extended, the shelter guests would have nowhere to go. And we'll speak a little bit more about both of those scenarios. So the reason we've reduced the request to 1 year is that we are working with the City of Trail on finding a suitable location outside of downtown for shelter services. So we heard loud and clear at the last meeting and through the correspondence received since then that the location downtown is not ideal, that it's having impacts. So we are looking at locations that are not downtown. So the alternate location would be for a temporary building that would operate until a permanent replacement is completed in Trail. There's a fair bit of work to do to finalize this temporary site, including technical work, securing municipal approvals, and starting construction. All that said, we expect to have it operational within a year. The important part to note here is that there will be a municipal approvals process on this alternate site. So you will be hearing from us again, I'm sure, to talk about that site. That's not the subject of the discussion today. We're talking about the temporary use permit on the current site. So that is it from me. I'm going to pass it over to my colleague Danette to speak about the implications of not extending the shelter.
Thank you, Tyler. Good evening, Mayor and Council, and people, residents of Trail. So the community implications of not extending, I think this is a really important discussion to have, and it's important to draw to your attention because of the potential devastating impact on the community should the temporary use permit not be extended. And as we enter into the coldest months of the year, I think that point is really, it should be top of mind as you consider some of the aspects of shelter operations. We know over the course of the La Nina shelter operations, we know that people who come to access services vary greatly in terms of their circumstances. And we've seen young ones, we've seen plenty of seniors, we've seen a number of people with disabilities, we've seen people who've had workplace injuries. We've seen people who have lost their housing because the housing prices have just skyrocketed. Rental rates are astronomical and the vacancies rates are very low. And so aside from that, aside from the fact that if we lost the shelter over the course of the winter, we would be putting people's lives at risk, and all those people that I just spoke about with varying circumstances really have no other services in community from a shelter point of view that they could rely on. What that does is it impacts community partners, our other community partners that are working so hard and whose systems are already fully taxed. If you talk to the RCMP, if you talk to the fire department, ambulance services, the regional hospital, everyone is working just as hard as they can to support the people that are already needing services. If we decant the shelter, it means that much more tensions for those systems to endure. And we know that there is not a lot of extras to go around in terms of finding extra staffing, finding extra officers, finding anybody extra to support this vulnerable population. We also know just from an economic point of view that the shelter employs a lot of people. The society was telling us that there are approximately 21 full-time staff that would lose their jobs as part of a shelter closure, which would have significant impacts on a small community, on a number of families whose parents, whose aunties, whose uncles, whose grandparents may work at the shelter, which would have significant impacts on the community as well. The other thing to note is that as part of the shelter contract, we provided the society with some additional dollars to do outreach. And that's not a common part of our service delivery model in other communities, but because Trail has, it's a very small community, as you know, and it's very difficult to provide services. So we increased the shelter budget to provide outreach. So if the shelter is no longer there, that means outreach is no longer there. And that means people don't have access to food security, for example. They don't have access to coming in for a shower or for a referral to an important community resource for them. And so the other thing for businesses is that, there wouldn't be an opportunity for businesses to reach out to CDS if they have an issue with someone who is around their business. And finally, you wouldn't see that community cleanup that currently takes place as a result of the outreach. So we just wanted to sort of underscore the community implications of not extending. It is a serious matter, and it would be extremely devastating if that were to happen in the community of Trail. So my comments.
Okay, thank you for that, BC Housing, and just to clarify too, there was a thought, I think at the last meeting, that if the temporary use permit for the extended 18 beds was denied, that it would go back to the 8-bed winter type shelter. We've been informed that it is not increased, that the proponents will not operate a limited bed shelter. One of the main reasons of that is that they're already turning people away from the shelter at night. So to now have an additional 10 people that have places to sleep, they do not want to put their staff in the harm, danger, just the personal situation of having to deny more people a place to stay. And so for that reason, there will be no shelter. And again, as the BC Housing noted, the current services that are provided through that. Again, we know that it's a challenging time down there in that part of town, but just be clear that in losing the shelter, that at least for a time with no services, it is quite likely to be quite worse. And again, we have IH, Lennon, who will speak up.
Thank you, Your Worship, councillors, and members of the Trail community. I will introduce myself to start. My name is Lannon DeBest. I'm the Clinical Operations Executive Director for Interior Health within the Kootenay boundary. And I am hoping to review with the members tonight what services IH currently has in place, and also spend some time talking about the connection between homelessness and mental health and substance use. It's an important connection that I believe is relevant to our conversation today. And I think I'll start there. So we know that the connection between homelessness and mental health and substance use is high, that all the research supports that. We know that homelessness and that state of stress that people are placed in when they are homeless exacerbates all elements of mental health. And the clinical literature also supports that people who were previously not experiencing mental health or substance use can and quickly do start to develop anxiety, depression, which can lead into substance use. We know that also within the realm of healthcare, that when individuals have a predictable place to call home, as our partners in BC Housing have spoken to, that element of safety and security allows them to participate in their treatment and further their journey on a path to recovery, if that is their journey. It helps improve personal coping, relationships, and community involvement. There's no doubt in my mind that in the event that we have additional individuals who have higher housing insecurity, that we will see increased demand on our local health services. We will see increases in utilization in the emergency department. We'll see increases in hospitalizations for mental health and substance use related disorders. And our partners in our mental health and substance use team that work in the community will be overtaxed. And so now I'll spend some time just talking about some of those services in our mental health and substance use teams. Just broadly, we have our OAT program, our treatment support and recovery program, our substance use services, a crisis response nurse, and a youth intensive case management. I'll just spend a bit of time just going over what each of those are. So the OAT program is opioid agonist therapy. It's a program and a place that is physically located, as well as we have outreach workers that connect individuals to take a drug like Suboxone, which allows them to begin their journey of recovery and treatment for their substance use. Our OAT program staff, there's a nurse practitioner, there's 2 registered nurses who also prescribe, and outreach staff. They will deliver medication. They will prioritize harm reduction. They help support the medical needs of their clients with wounds and other medical needs. They will provide training for Narcan or naloxone use. And they also will respond to calls from our agencies and our partners to support individuals' treatment plans. In addition to that, we also have the treatment support and recovery services that's staffed by 2 social workers and an outreach team of 7 staff. And this team works predominantly with those that are housed and those that are homeless or at risk of homelessness. They will go into shelters to support clients with their need and substance use. They will go to our hospital to help with liaising and transitioning people from hospital back into community. And they also support with medication administration. Next is our substance use services, an RN that is there to provide counseling for those who are experiencing moderate and severe substance use concerns. And that nurse will support people in getting into residential treatment, support with assessment and interventions, be involved with clients who need support with a psychiatrist and setting up psychiatry appointments. Next, I'll quickly talk about our crisis response nurse. That's a 7-day-a-week service from early in the morning until the early evening. And excuse me, the RN who is responsible day to day for doing this work is available to our community partners at La Nina and other agencies, is available by phone to respond, as the title says, to crisis. The nurses also work in close collaboration with those who present to our emergency department in crisis and supports them in getting connected back into the community to receive services. An integral component of our mental health and substance use programs, and is available to, like I say, many partners, including the public. And then finally, I'll just talk about the youth intensive case management team. So this is available for youth between the ages of 12 to 24 that have significant substance use concerns. This is a high intensity interdisciplinary team that works with youth in the city of Trail. The team has clients that are homeless as well as those that are using the shelter services. So those are the key programs that exist within our community to support those who are experiencing mental health and substance use. We know that this is a partnership, that there are multiple tools and approaches in order to serve a population that is complex, that has many needs. We work very closely with our partners at La Nina and BC Housing to provide services. And the fact is that the La Nina shelter does provide a consistent touch point for our team members to be able to connect with those that can be hard to connect, and provides that place of respite and access for the health team. I do believe that there were letters received by council that were shared by our members of our medical staff, including our general practitioners from the hospital that provide care to our inpatients that are admitted in hospital, as well as our emergency department physicians. In addition to that, the medical health officer was also part of a letter that was sent to council, just outlining the importance of having reliable housing for this particular population. And it would be my ask as Interior Health representative that the opportunity to continue to have those 10 beds at La Nina be approved as my colleagues at BC Housing have presented. Thank you.
Okay, thank you so much for those comments. I also forgot, Your Worship, to mention that Trail for Community Living is also here, but mostly I think to take any questions that may come from yourself or council. I don't know how much further, Your Worship, you want me to go through it on the report itself, and or if you just want to open up for council who have read it, if they've got questions for BC Housing, IH, et cetera.
Sure. So, Trail Association for Community Living, do you have anything that you want to present or say before we open up the floor?
Thank you and good evening. Thank you, Mayor and Council. No, tonight we're here just to answer the questions from the community and any other persons that may have some questions regarding the shelter.
Okay, great. Thank you very much. All right, so I'm going to open up the floor right now for council. Just if anyone has any questions of our panel. So Councillor Kashoni, please go ahead.
Well, I kind of thought that Colin was going to go through his report. It's a very good report, and if they haven't had the opportunity to read it or to listen to it, I think it's really important that people hear what he has to report, because I think it's a.
Oh, so you're on mute, Councillor Kashoni, but we got the point that CAO McClure, would you please go through your report for anyone who didn't get the opportunity to read it?
Thank you very much.
I'll do my best to enunciate here.
Can you mic up, please?
Sorry?
You mic up?
I can't really, is the only mic, and does it speak to this room?
This is, yeah, we can.
Can't hear you. Well.
Is this any better?
No.
There's, yeah. So anyway, I will do my best. Will it pick it up there?
You're just, it's just your voice there.
Yeah, I know, but if I stand there, will that connect and feed through the speakers that we're hearing? If I speak at the counter? No.
It is better, Colin, right now. It is clearer
Okay.
than before.
Okay, all right. Okay. Yeah. Okay. I'll do my best. So I'm going to start, first of all, with the background component of the report. And we know that we had a meeting on August 15th, and we had many from the community speak, whether it was online or in person, about some of the personal and challenging issues that they've had with dealing with the homeless vulnerable population here in Trail, but also those that were for and that are proponents of or are passionate about making sure that Trail does have a shelter for those that need this service. And we know that there is a desperate need. So from there, the city received considerable public input from that meeting, and we have provided that. And again, if you were to have downloaded the agenda, you would be able to see that, and both written and both in favor and against the shelter renewal. One of the things that came out of that last meeting was the thought process of being able to revoke the permit, because they were asking for a 3-year permit, that after a certain time frame, i.e. like an annual, that if the shelter hadn't improved or if there hadn't been certain places put in certain parameters, i.e. security or whatnot, were not put in place to the approval of council, that they could revoke that permit. What we did find, and I was sent back to get a legal opinion, was that no, on the face of it, once council provides a temporary use permit for a period of time, that cannot be outrightly revoked. There could be some other ways of trying to persuade or have restrictions, but that would be something that could be a legal battle before trying to get any actual closing of the shelter. So that was where that legal opinion was very clear, that we cannot revoke the temporary use permit. So since that meeting, there have been staff were directed by council, and we have had numerous meetings with RCMP, the regional fire chief, the shelter operator, BC Housing, and Interior Health. One of the major pushes for that was to see what opportunities, what resources are available to assist the shelter in trying to improve the operations and some of the behaviors in around the shelter. For those that may think it's easy, it's not easy for the RCMP. If someone is not in the shelter, even if they are kicked out of the shelter, they can stand within 1 meter of the shelter. And really, as all of us as Canadians, you can be in that vicinity. There's no right of stopping you, even if you've been banned from being in the shelter. So that makes it very difficult for the shelter operator, because many of them, would be trying to move these people along, knowing that they're interacting with the other participants or residents of the homeless shelter, but without the ability to actually have them vacate the premise. That's also the same for the RCMP. They can come down and try to converse with the individuals that may be causing issues, but cannot move them on. So one of the things as that was going on in the background is that the mayor and 2 councillors and staff attended UBCM on the week of September 17th. We met with the minister responsible for housing and the attorney general, as well as BC Housing senior staff. And we were there to, first of all, advocate for a permanent shelter in Trail. That is one of the main pieces, but we were also there explaining and briefed them on the current crisis that we're having in Trail. And the very heartfelt concern of our politicians and those that care about our community of the potential chaos of actually closing the shelter completely, especially with winter quickly approaching. These meetings with BC Housing and the city were fruitful. And I think along with the push from the minister responsible for housing to work with BC Housing on a commitment to find a location outside of the downtown core for a new temporary shelter that needs to be completed within 1 year. That is why we're looking for a 1 year. The hope is that it would be sooner than that, but there's sort of that window of trying to go through all of the regulatory hoops that we will need to go through in order to make it happen. And understanding with winter approaching, not the best time to be making a switch over from the current shelter. So at that August 15th council meeting, and after thorough and through written submissions, council heard from many members of the public of their concerns of providing a 3-year extension to the temporary use permit. The main thrust of the comments related to allowing the shelter to The main thrust of the comments related to allowing the shelter to continue serving the homeless population in such close proximity to the city's downtown businesses, educational and cultural district, as its operations have been associated and created conflict with residents, business owners, and has impacted negatively on the neighboring properties. Council heard these concerns loud and clear and directed staff to meet with BC Housing, as well as to set up meetings with provincial ministries to advocate for a permanent shelter in Trail outside of the downtown core. Staff also engaged the BC Housing, RCMP, fire, and shelter provider in looking at what options were available to improve operations at the current shelter, in addition to finding a suitable location to move the shelter from the downtown core. Staff and BC Housing are currently reviewing options of properties outside the downtown core that will be suitable for setting up a new temporary shelter, and are confident that a solution can be found. As a result of these discussions, staff and council have informed that if there is no extension of the temporary use permit for the shelter, that the operator is not willing to go back to a winter shelter with a lower bed allotment. This will result with Trail being without a desperately needed homeless shelter, which will negatively impact those that are needing this help and support desperately, and will likely result in pressure on the local hospital, as well as potentially causing chaos for a time in the city downtown core after the closure. BC Housing continues to actively pursue opportunities for permanent supportive housing and shelter services in Trail, but as of yet have been unable to determine and find a suitable location. In order to work with BC Housing on the commitment of finding a new temporary shelter outside the downtown core, it is felt that providing a 1-year renewal of the current shelter temporary use permit will put the pressure on for making something happen, as if it is not resolved in a year, the shelter would have to be shut down as the new temporary use permit extension cannot be further granted by council. Based on that, the recommendations that I'm putting forward as staff to council is that council take into account the update from BC Housing, Interior Health, the Trail Association of Community Living, and the public input received. Consider the renewal of a temporary use permit to allow the expansion of the homeless shelter to the 18 beds that operates within the premises of 1456 Bay Avenue for 1 year. Number 2 of the recommendation, that council requests an update from BC Housing by October 31st of 2002 of their commitment to provide an approved life safety plan for the La Nina shelter and approved by the regional fire chief. Third recommendation is that council request an update from BC Housing by October 31st of 2022 on their commitment to provide 8 a.m. to 8 p.m. daily security at the La Nina shelter during this 1 year period. Again, council, that's my report, and I will pass it back to you.
Thank you. All right, so I just want to open the floor right now for council. If you want to ask any questions of Interior Health, Trail Association for Community Living, or BC Housing, please just raise your hand and we'll give you an opportunity. Councillor Joby, go ahead.
Okay, thank you, Mayor Payson. I would like to direct my question to Mr. DeBasket, Interior Health. You gave us an extremely good outline of all the opportunities in terms of varying supports that are available in the community right now for the homeless. There's one particular question, though, I'd be interested in hearing an answer to is, how do you measure success? And to me, success would be that we've have 2 or 3 individuals who we managed to get off the drug situation, that are no longer codependent on any kind of medication and are able to move forward their life and no longer need to be in a homeless shelter. Can you give me numbers on those kinds of issues in terms of success?
Thank you, Councillor Doby. I don't have numbers with me that I can provide this evening. It's something that I can get. From my perspective, success is measured in a number of ways, including those that you've described, supporting individuals who are on their path to recovery and move from total housing insecurity to secure housing. Absolute success. And I think our partners are included in tracking and understanding the impact. From a health perspective, there are a number of things. We look at hospitalization rates. We look at our ability to connect individuals who have presented to an emergency department with mental health services upon discharge. We look at the number of individuals who are accessing opioid agonist therapy. We look at those that we are actively following through case management, through our outreach services. Those are all measures of success for us and also represent a challenging measurement. We know that the population of individuals who live with mental illness and substance use can be transient. So it's not always 100% clear to us if someone is on a permanent path to recovery or have changed communities. That is a reality of our challenges. But we do closely monitor the things that I've mentioned. Thank you.
Okay. Thank you for that. So in terms of, as you can imagine, we have had all kinds of correspondence from the public, some who are pushing for the extension of the La Nina shelter, and others, not only residents, but strong response from some of our businesses in the downtown core that do not want to see this extension. So I did an interview this morning with CBC Radio, and one of the questions that I was asked was, so you're in favor of shutting down, not having a homeless shelter in the community? And I said, absolutely not. We are desperate to see a proper facility in this community, and I have worked very hard in supporting the homeless in many ways. I won't go on to all of that now, but since we increased the numbers to 18 from last year, so we've had 1 more year of helping and providing meals and proper sleeping facilities for more people. We have not seen one decrease in the amount of issues that continue to occur downtown. The call out percentage for RCMP and first responders has not decreased one little bit. So I think when you look at what the businesses are saying and what the citizens are saying, this is part of their measurement tool. They can understand your explanation and what you're trying to provide for us, which again, I can't say enough about how important it is to have this in the community. But this is a two-sided coin, and this is the other side of the coin that citizens and businesses are so concerned with, that they're just not seeing any changes. It's getting worse. As we know, one of our current fast food restaurants announced last weekend that they will no longer be available in certain hours during the day. And just this morning, I received a call from a local businessman who just in the last few days has sustained over $1,500 worth of damage to his entranceway to his businesses. And he's got it on film. If I want to see it, he said. And he, as far as he's concerned, these are people who are homeless. So we constantly get these phone calls. So I'm not sure we're getting a true measurement of just how successful all this is. Just in terms of the fact that over a year with the increases I said, we're not seeing any changes in the downtown core. So thank you for answering my questions.
Thank you. Would someone else from council like to address and ask a question? Councillor Kashoni, go ahead, and then I'll go Councillor Santori next.
Well, it's not a question, but if you listen to Colin, and I think it's a great report, and it provides a lot of sort of thinking about what's going to happen in the future. And I think the main issue on Colin's one is the item of 3.8, and I'm just going to refer to it again. These meetings with BC Housing and the city were fruitful, resulting in a commitment to find a location outside of the downtown core for a new temporary shelter within 1 year time frame. I think that's what the community should take a look at. I'm not crazy about extending the permit, but this will provide, I think, and I thank Colin for that particular thing on the work that was done by the members who went down to the AGM. It'll provide a basis, for example, moving it out of the downtown. And within 1 year, I really think that BC Housing, because they are pushed by the ministry, is going to fulfill that promise. And if they do fulfill that promise, it's the best for everybody in the long run. I know we're going to have to put up with it for 1 year, and that's unfortunate. And it really is unfortunate because I get the same kind of phone calls. But nevertheless, it is a compromised position, and I think it will lead to a permanent residence for these people outside the downtown core. So thank you, Colin, and I really appreciate how you structured that particular report.
Okay, Councillor Santori, you're next, and then Councillor Butler. And Councillor Santori, you're on mute.
Thank you. I have a few points I want to make, but I also want to comment on, I mean, prior to this 3-year permit, we had 8 beds providing cold weather shelter only, correct? Just want to make sure I have my okay. It's stated in the correspondence in the report that La Nina would not accept going back to the 8 beds. I guess my question, and you can answer it later, would you consider keeping the 18 beds as a cold weather shelter? 3 years prior, we did not provide meals. It's only started 3, or at least I don't think we did. Did we? We did, Sheila? Okay, my apologies. I don't have those facts straight. But let me begin by saying that over the past 3 years, and I think Carol touched on it, the number of individuals in the alleys and the streets have increased significantly. Our police calls have been increased significantly. And correspondence received by the RCMP is not favorable in terms of the outcomes and some of the things that have been witnessed and documented in their files of what has occurred. Our first responder fire department has been down there considerably more than it did in the past. Our crime has continued to increase. Our bylaw enforcement officer has been put in dangerous situation and quite frankly, should not be exposed to that. As Carol said, we're missing the other side of the coin, and that's our businesses. Nanette mentioned how many jobs would be lost with the closure. Well, there's been jobs lost in the private sector as well. And I think they're equally as important as those people that work at La Nina. Reduced hours of operation, closed businesses, those people are out of work. I want to comment on some of the things that Lannon said. And Lannon, I totally agree with the services that are provided. And I believe that they are helpful. And I'm sure that you do have some success stories. The issue is this, it's strictly voluntary. And I think the public needs to know we cannot force an individual who is addicted to narcotics to be treated. And my question to Lannon, and I'm not sure if it's the RCMP, Lannon, and I'm not an expert, but I would assume that someone that is seriously hooked on drugs, at some point, that results in some form of mental illness as a consequence of the abuse of drugs. And the only time that one can be forced into treatments is under the Mental Health Act. Who determines when a patient, like, where is the fine line between drug addiction and then having mental disability, which then would require that individual to have mandatory treatment. And the reason I'm bringing this up, and I think we need to be honest and upfront with the citizens of Trail, a shelter, a new shelter at a new location, fortunately, is not a silver bullet that will solve all the problems that we see here today. That is not going to happen. For those of you that are in the gallery, if you think that a support, it will help those people who want to be helped. It will not help those who don't want to go into treatment. It will not eliminate the number of people, the same people that you see today in the downtown core causing our problems will be there again after the shelter. If not them, someone else. I just want to be clear with the public, and please, Nanette or Sheila or Lannon, you can correct me if I'm way off base, but I've experienced this in the East End when I was in government. I've seen housing projects in the hundreds of millions of dollars. I've said this before. And the problem in the east side of Vancouver is worse now than it ever has been. So let's not think that this housing is a panacea, silver bullet, and our problems are going to go away. I'm going to say it now. I've said it once and I would say it again. Our provincial government and our federal government, including the government I used to sit with, has failed miserably in dealing with drug addiction and mental illness. We have more people dying of opioid crisis than COVID. And don't get me wrong, I totally support what we did federally and provincially with COVID, but we have not come close to investing the money that we should be invested in dealing with the opioid crisis. Instead, we have shut down Riverside, Woodlands, Essendale, Crease Clinic, institutions that help these people. And the concept back then was, let's localize it into communities. Let's take the services away from the Lower Mainland and handle it within a region. We don't have the capacity in this small community to do that. I don't believe we have the expertise here to do it. Furthermore, it's taking up a third of our downtown core. This is a small town. Like the east end of Vancouver, yes, it's bad there, but it's at the east end of Vancouver. It's not in the downtown core of downtown Vancouver. This is occupying 1/3 of our downtown core. I understand these people have rights, but the rights of those who are breaking the law should not come at the expense, and I don't mean financial expense, but at the detriment of the rights of other people. The right to walk down the street safely, the right to not fear being spit on, assaulted, or yelled at. I mean, unfortunately, the focus is going on the rights of people who have no rules and no regulations. And those who follow the rules are the ones who face the consequences. Now, effective January 31st, and Lannon, maybe you can answer this question for me. Effective January 31st, although it's already happening, they are decriminalizing small doses of narcotics. So the people you see on the streets will now be allowed, okay, to carry drugs without any fear of arrest or charge. As a medical expert, maybe you can explain to me how decriminalizing that is going to help these individuals get off drugs. That's like prescribing a cigarette to a lung cancer patient, in my opinion. How does decriminalizing it help these people get off drugs when we're saying, and not only that, what message does it send our youth? The young person says, oh, they decriminalized fentanyl and crack cocaine. Can't be all that bad if our leaders are allowing us to carry it on us. I don't think that's a great message. I really don't. So maybe, Landon, you can explain to me what decriminalization and putting drugs in their pockets is going to help. How is that going to help a patient? Because I need these answers in order for me to make a decision at the end of this discussion. There were letters and emails sent that blaming council for a failure of providing toilets. Well, for those of you that wrote those letters, we did provide toilets. It got so bad where people were passed out in them, doing drugs in there, to the point where the providers of those toilets would refuse to send their employees there in danger of their safety. So for those of you who think this council failed in that regard, you need to get your facts straight. And I'm setting the record straight now. This council, despite our problems, have done everything that we could possibly do to minimize the impact that unfortunately people with mental illness and drug addiction have caused to this community. And sadly, because of the failure of both levels of government, this will continue until such time as they make the proper investment and set their priorities straight. As I said before, spending $500 million on 10 soccer games is a waste of money. We could use 1/4 of that $500 million to solve a problem here in Trail. But I guess soccer is more important than the most vulnerable people in our society. And I could give you a lot more examples. I believe I had one other question. I would really like for Landon maybe to respond to the where the threshold of drug addiction and mental illness is, and when the Mental Health Act can be applied so that people can and must get mandatory treatment.
Your worship, with your permission.
Absolutely, go ahead.
Thank you for your questions, Councillor Santori. I've done my best to capture those, and I'll do my best to answer them. If I've missed anything, please let me know. So to start with, a very good question about that line between someone who's presenting with mental illness versus side effects of substance ingestion or injection. It is hard. It's hard for members of the community. I would say it's hard for members of our police services to distinguish someone's behavior as being related to their brain health issue or a substance use disorder. The Mental Health Act, I'm going to paraphrase. Sorry, let me actually pause by saying, so my background is not medicine. My background is nursing. So I will present what I understand as the answer as my role as a registered nurse and as an administrator for Interior Health. I've worked quite a lot with the population that we're talking about tonight. I too worked and ran the emergency department at Vancouver General Hospital for several years, so I understand some of the real feet on the ground points, concerns, opportunities, and issues. So when someone's behavior is altered in the community, under the Mental Health Act, the police can arrest somebody. I think it's Section 28 of the Mental Health Act gives the police the opportunity to arrest somebody and present them to a designated facility, which Kootenay Boundary Regional Hospital is, for an assessment and an evaluation. If a physician will assess that individual with their behavior, if it's unclear if the behavior is related to an organic brain health concern, And what I'm referring to there is something like schizophrenia, bipolar disorder, or another organic brain health issue like that versus substance use, then the person may get admitted and will be observed and given an opportunity for the medication drugs to clear from their system so that an assessment can be made. When the RCMP would arrest somebody, that's an involuntary admission. When they come to hospital, they may be sectioned under the Mental Health Act, which then allows healthcare practitioners to hold somebody, a physician to hold somebody in hospital for a period of time for an assessment and an observation. That period of time is limited. It's 48 hours. If in that period of time it's deemed that a brain health issue is at play, then another physician, a psychiatrist, will admit them, and that allows us to hold somebody in hospital for 30 days for observation, treatment, etc. The Mental Health Act is very clear that we have to abide by the Mental Health Act with respect to the rights of our patients who are in hospital, and they have the right to disagree and ask for an adjudication as they believe that they are being held against their will. So it takes that process to really determine whether or not there's a brain health issue or a substance use issue. Again, to many people, to myself as a clinician in emergency, it's not always apparent. We use history about a patient to make some of those determinations. And I'll pause there to see if I've clarified for you that distinction and how we navigate that distinction.
Medically, I'm assuming you're very accurate in terms of how you assess these people. I mean, I look at the Mental Health Act. What limited knowledge I have of it is that if one is a danger to himself or a danger to society, or to the public at large, then they're deemed to fall under the Mental Health Act. Now, obviously, it's not quite as cut and dry as I've made it, but nonetheless, I accept your answer. And it's unfortunate. I'm not talking about unfortunate for the citizens of Trail. It's unfortunate for those patients who should be getting more help, but because of a process and I guess a call from a physician, are back on the streets within 48 hours. And we see that, and we've heard from the RCMP, which, by the way, they spend a lot of time, not only in the downtown core, they spend a lot of time up at the Kootenay Boundary Regional Hospital, because they have to be there when a patient's been admitted and to ensure that the staff and everyone there is safe while that person is still high on whatever drug that they're on and might present a problem up there. If I could ask you about the decriminalization and what benefit that has to allow people to have personal amounts of what was an illegal substance. I find this rather confusing. And I mean, I don't mean to joke about this, but if I wanted to open up a beer at Gyro Park on a sunny afternoon, I'm subject to a fine. So it's illegal to have a beer at Gyro Park, but now they're going to allow you to have your personal stash of fentanyl, crack cocaine, whatever, on your person without any consequences. How does that help a patient?
What we know in the international literature related to substance use, and I can't speak to any plans that the federal government has with respect to decriminalization.
January
I'm not certain.
31st. January 31st in the province of British Columbia.
Okay.
And the police aren't enforcing it now. Sorry, Len.
Okay. What we know is that when we give individuals access to supply, and supply is accessed by many people in the community. As we know, mental health issues exist for many people in the community. The numbers are double digits, 30% or more of our community experience mental health concerns. So when we give people access, again, in the literature, if it opens up the opportunity for us to provide safer supply, we reduce the risk that individuals have with toxic drug supply and death. And if we play our cards correctly and give people the opportunity to consume their drugs in a safer place, again, we reduce the impact to that individual and risk of death. We have the opportunity to put it in a location that's not as visible. as many people use on the streets at the moment. So I think there could be a connection between decriminalization and the opportunities to offer a safer supply.
I get that. It's no different than a safe injection site that they've had in the Lower Mainland but the law extends, they're not talking strictly about, and maybe someone can correct me if I'm wrong, but if you bought drugs from a local pusher, a local drug trafficker on welfare day or when they receive their disability check, and you buy illicit drugs from a drug pusher and those are in your possession, nothing happens. So it's not the ones that are administered or prescribed by the medical by medical experts or physicians. That I get, but they will be allowed to continue to buy their drugs from their local dealer in the alley and not be subject to any repercussions for having possession of illicit narcotics. That's not your problem. But I think people need to be aware of what's happening out there and that our RCMP have absolutely no tools. And I totally get the frustration of the people. And I see many of them in the gallery there that have called me or written to me. We all get it, but the RCMP's hands are totally tied. And until they make changes to the charter, to civil rights, and it needs to be changed. But anyways, I've said my piece. I'm undecided at this time. I am encouraged. My feeling of BC housing Nanette has gone up a notch or two from where it was before, based on what I've witnessed in our meeting or the meeting that was held on Zoom last week, and what appears to be successful meetings in Victoria. Again, having been there, when a minister makes that type of a commitment, they don't make commitments generally to a community that usually you get, well, we'll see what we can do and catch you later and thanks for coming. It doesn't sound like that kind of a meeting. And so I am somewhat encouraged there, but just so people know that this is a worldwide problem and there's no silver bullet. We can minimize the impact on our community, and hopefully we can, between the providers, that we can minimize the impact that this has moving forward on our community. And I think that's the best you can ask of this council and probably the best you can ask of your future council. So thank you.
Thank you, Councillor Santori. Mr. McClure, you had your hand up there.
Thanks, Your Worship. A couple of things I just wanted to talk about that I kind of was somewhat missed that Councillor Santori raised was people, kind of that prolific offenders, people that are behaving in a manner that there's some that, yes, you get, but some that are really, doing all of the crimes, especially because of the drug addict. We did get some feedback. It's still legislation, the report is being put together, but that the ministers in this government are waiting to report on the prolific offender. And again, as you said, there will have to be some sort of investment that goes with that. But it is taking those individuals that are doing the majority of the damage or the crime and not allowing them just to, be released over and over and over again. And that they are committed to trying to solve that particular issue. It doesn't mean that someone else isn't filling that spot, but there is a plan for those because they do know that those individuals are really, really jacking the numbers. The other piece that I just also want to talk about is the thing about trail that's happening. It's sort of one of those kind of phenomenon from COVID, is that everyone said, we got to get out of the city, we got to live rural. Well, Trail is a beautiful rural community. And if there's anything that we've seen in the last couple of years, or at least when I look at the assessed value changes, is that housing prices are going up. And when they go up like that, when assessed values change, that is because there have been sales of properties. So people are selling properties that they've had. And our understanding is that's one of the pieces that is driving some of the homelessness, is that homes that have maybe a person bought or was renting out has increased significantly. We had an average of 28% increase in assessed value across all homes in Trail, and people are selling. people are buying those properties, a lot of times maybe to move into themselves, or they may be taking those properties over to do some fixing up. And with the huge increase in what rents are getting in Trail, that is also a business proposition for some. Property that was lower, buying it and then changing it over and then increasing the rent. That is all really affecting and or increasing the numbers of people that are homeless or that weren't homeless but now are. So that can be one of the correlations between why we may not be seeing some of the results of having an 18-bed shelter and expecting that this would be getting better, is that phenomena of people wanting to come rural and the increases in the housing prices and almost a business investment situation that you were seeing over the last couple of years with increased rents is a factor in why we're seeing more people on the street today. Thanks, Mayor.
Thank you. Lannon, you wanted to have a supplemental answer that you felt from Councillor Santori's comment, so go ahead, please.
Thank you, Your Worship. Councillor Santori, this is in relation to your comment about a panacea, that housing is not a panacea. And I agree with you. I agree that housing is not the panacea. The way I envision the work that we do within health and with our partners is this, that there are many strings we've woven together that form a net, and housing is one very large string. And if we take that string out, more people can fall through that net and fall into addiction and fall into harder times. Our goal within the health system is to use the services that we have. Jane Power and I continue to work with our mental health partners in the health authority and at the province to bring in additional resources, because it takes a number of different approaches and services to provide care and to get people on a path of recovery when they choose to do that. Thank you.
Thanks, Len. Just in response, I was not suggesting at any time that I am opposed to supportive housing. I totally get it. And I would support in a heartbeat a new facility providing the services that the vulnerable people need, providing that they have the medical staff and the experts and the capacity to do it. That I would have absolutely no problem. And I think the community, we have a very compassionate community. Trail is made up of compassionate people, and they get it. They just don't like what they're seeing because they don't feel that the services that these people need are being provided, at least not to the level that we are seeing any outcomes, as other councillors have mentioned. It would appear on the outside that the Ministry of, mental health, addiction services, and career development services are working in silos. Now, I may be wrong. I'm just telling you what people have told me, what they've experienced, and some of what we are hearing from our other authorities, be it the fire department or the RCMP. So I don't think the people of Trail would object to having a proper medical facility that will actually help these people. We know we're not going to be able to help everybody. That's a given. That won't happen. I just want to set the record straight. It's not that I don't want supportive housing. I totally support supportive housing. But as I said earlier, there needs to be a true partnership and case files and follow up 9 yards, which I'm hearing doesn't always take place. But anyways.
Okay, thank you. Councillor Butler, you were next.
I was next, I think.
No, actually, Councillor Butler put his hand up just physically, and then you're next, and then Councillor Jones. So thanks very much. Go ahead, Councillor Butler.
Well, thanks, Your Worship. I just wanted to sort of just say more of a statement than any questions to anyone, and that's as being one of the two councillors, along with Councillor Jones and yourself, Mayor Payson, being down at the recent UBCM. I want to convey both to my fellow councillors here tonight and the public that's joined us. I want to stress how the discussions that we had, the pressure that was applied, the lobbying that was done, and the concerns expressed, I feel have truly, and I'm quite confident in my own opinion, that we've moved the needle on the issue. And And that I would also like to say that I feel that what BC Housing is bringing to the table tonight is workable. We've moved from 3 to 1. We've moved a shelter from a downtown core into another location that's been described to us as being outside of the downtown core. And then a commitment also for a continued work on a long-term solution. So I think it's also important that we're here to talk about, or what we're talking about is a temporary extension. So I really do want to just say and convey to the public and to everyone out there that I feel that it's sometimes just these small steps and not sort of undeliverable big promises that we're all wanting are really the things that are going to lead to some lasting change around here. And the last thing I wanted to leave off on my comments off was I think I can share it, but we received that many letters, which is a huge amount. And I think most of us here, I think Robert Kashoni probably did the best of reading through every single letter, but I think we've all read through all those letters. And one that just stuck out for me at the end was actually from a shelter guest themselves, who simply said they use the shelter simply for the need and the want to exist in this world. So I think we have to look at this from definitely a level-headed approach, but also one of compassion. So thank you. And it was, I would just like to also give kudos to Mayor Payson, Councillor Jones, and Mr. McClure for all that done. I think it was quite incredible to be in those rooms. And as Councillor Santori has mentioned, sometimes you just get blown off. Yeah, we'll talk to you later. But that's not the feeling I came out of those meetings with. So thank you.
Thank you, Councillor Butler. Councillor Kashoni, you're next.
Just very quickly, there's no doubt that the criminalization is going to have a major impact. 2 years ago, Oregon decriminalized all of the drugs. They are one of the states now with the highest rates of addiction. Their death rate in terms of overdoses has gone up 20%. They spent $302 million in 1 year to try to do anything about it and had very little success. And when they determined there were 16,000 people who assessed the services, which would be in these kinds of shelters, 16,000 people, only 0.85% entered treatment. That's directly from the report from Oregon. So as a number of people have said, don't think that this temporary moving of the shelter is going to be a panacea. It is a problem that cannot be dealt with by local government. We do not have the capacity. So I agree with Sandy, I agree with Paul there, and anybody else who tells you that it's going to get better right away. It's not true. And Oregon they're rethinking the whole decriminalization, because decriminalization means that you can go into, for example, downtown A&W, put a line of cocaine on the table and snort it. Nobody can do anything about it. So it's not good for people. But I do agree, Paul has said here, those small steps, I think, is what we have to look at, because we can't solve all the problems. Thank you very much.
Thanks, Councillor Kashoni, and just thanks to everyone who's spoken so far to just set some realistic expectations on this. So Councillor Jones, go ahead, please.
Well, thank you, Mayor Payson. I'm not going to repeat what all the other councillors have said, because, they've made some really good points, and I really appreciated the conversations that we had down at the UBCM with BC Housing and staff. And, we made some really good movement. We had great conversations. They knew what our priorities were. We talked about the crisis that we were in, and it was difficult, conversations sometimes, but it needed to be had. I want to thank everybody that wrote an email, sent a letter, made a phone call, or messaged me in some way about this issue. I appreciate the community being so involved and so passionate about it. I honestly tried to reply to all the emails, but I have to say it was quite difficult because there's quite a few. I wanted to just circle back to when we signed the agreement back in 2021, in September of 2021, and we put almost 20 stipulations on CDS and I believe IHA, if we moved forward with the 1-year extension. In quite a few of the emails that I received, businesses, citizens, they all talked about, you know, how dirty the streets were, feces in their doorways, needles on the sidewalk. You know, it just painted a really, really horrible picture of a community that we're all so proud of. And I'm just wondering, Sheila, I know there's a lot of items on that list, but can you just circle back and tell us exactly what CDS is doing for our community downtown right now before we move forward with this?
Yeah, we have outreach workers out during the day, all day, and we respond to any issues that come up with any employers or community businesses. They contact us, we clean up any mess that might be left. We also have a route that we walk. We don't wait for phone calls. So we walk from 7-Eleven all the way down to the old bridge, and we look at any areas that might be hot spots or that we've had calls on before. So we do that twice daily, as well as respond to calls. The alley behind the shelter is cleaned on a regular basis, garbage pickup and or washing of the streets or whatever needs to happen. But we do respond all throughout there. Now, typically the shelter coverage for most shelters is a 2-block radius around the shelter, but we take it all the way up. We have one of the shelter or the Street Reconnect goes with a couple of the shelter guests that go to all the parks and trail on a bi-weekly basis and make sure that it's clean. We have other shelter, so we do a walkthrough. So Ben Street, B Street Park, Gyro Park, all of the park areas, just to make sure. And if we see any areas that might be hot spots, we definitely revisit them on a regular basis. We've lobbied with mental health, interior health for areas that are in need of sharps containers and have had them put up in different areas where there's stuff like that. So we are out every day and we are cleaning, and we get a lot of positive response from the downtown businesses. We had a downtown business that had a screen ripped. We replaced the screen. So we're responding quickly to any concerns and speaking with the individuals to ensure that for the core group of individuals are definitely doing their part to make sure things are clean. There are other individuals that are maybe not able at this time to follow through and are very ill, and we're working with Interior Health to assist those individuals to get the types of supports that they absolutely need. So we work to make sure, and respond quickly.
Thanks, Sheila.
Just want to see any other councillors have any comments. Councillor Joby, go ahead. Oh, you're on mute.
Okay, I'm off. Okay, I'd like to direct this question through to Sheila Adcock. Some of the phone calls that I've received have been from individuals who are questioning the numbers that are saying that these are permanent residents of Trail. My definition and the definition of a lot of these citizens that are questioning this is that a permanent residence is basically somebody that has spent most of their life here. So I think there's probably a delineation line here that decides what is a permanent residence and what is not. Would that be somebody that's been here for a year, 2 years, or 3 years that puts them in the category where they're a permanent resident? Because I can't say that the numbers that we have been given are somebody that has lived their whole life in Trail. They might have been born here, moved away, and then ended up coming back. But we cannot say that a permanent resident is somebody that's lived their whole life in Trail. There's got to be a line of delineation here.
Well, I probably can answer that question for you, Councillor Doby. So according to our statistics that we gather on a regular basis, currently right now we're providing services to approximately 37 individuals. 32 of those we consider as Trail residents. The definition of that is somebody lived here for 2 years. They might have been born here, like you said, they might have moved away and they've come back to the area, but they're definitely residents for the prior 2 years prior to coming to the shelter. So 32 of those, 37 Trail, 3 of them are from Castlegar, 1 from Fruitville, and 1 actually is a young gentleman from Saskatchewan that's been homeless since he's been 13 years old. So those are kind of the statistics of the individuals that we're currently supporting at the shelter, or outside the shelter as well.
Okay.
Yeah.
So Councillor Dobie, I think I'm just going to expand on what you said. So I think it's really important for everyone here to delineate what a shelter guest is and who the people that CDS and TALC are currently, I don't want to say responsible for, providing a service to, and those who are homeless and vulnerable who are in the community who are not receiving services. In the last 2 days, it's brought to my attention that there's a fellow here who's very high risk from Prince George, another one from Kelowna who came through Castlegar to here. So the shelter guests could be people that have just lost their housing. They could be senior citizens. They could be citizens who don't have high mental health and substance use, but need a place to stay for a short term until CDS can repatriate them back to a home. I truly believe that, and that is a role of our shelter. But where the lines become blurred, and I believe where the community is confused and understandably upset, is the smaller amount of people who are very much on the end of the spectrum, where they are more violent, they are more out in the community, they are unpredictable, and that's what's scaring people. And those probably are not your shelter guests, because they're probably either not wanting to have care, or they're not, they might even be kicked out of there because of poor behavior. So, I think we just need to know that there's a spectrum here of people that are being cared for in the community under the shelter on a temporary basis, and other people who probably are not from Trail that are probably harder to house and harder to treat. So I think it's a very fair question, but the answer of 37 or 35 from Trail is not representative of the full makeup of vulnerable people in our community. And I'm just going to address. So, we heard loud and clear from our community that this is a problem, a significant problem for the community. And this wasn't a surprise, because council collectively had been advocating for 3.5 years with CDS and with BC Housing to try to get, and with other groups like Trail Community Action Team, to try to get supportive housing. And I truly believe that we collectively are still behind that. And that's what we want. And, if you think of Maslow's hierarchy of needs, food, clothing, and shelter, if someone doesn't have a bed, how do you expect them to get stabilized? It's near impossible. So the shelter is but one piece of a larger piece that collectively the next group of elected officials and city staff are going to have to bring forward. And supportive housing is the next, and not necessarily in this order, but having greater health supports, having complex care supports, having more outreach. We have to keep going with this. And I really commend our community. We are considered a smaller community, but boy, are we mighty when we put our resources together and start advocating and get ourselves on the map. And we went down to up to Whistler, and they knew who we were. We were very clear in saying that we are in the middle of a crisis. BC Housing listened. The ministers listened. Within 2 days, we had a different response than when we got there. And all the letters of advocating behind the scenes in Trail, everyone who sent one, again, just like Councillor Jones said, thank you very much. It takes a village, it takes a community, and we've moved this forward. And there was a lot of time spent at the UBCM, not only advocating but going to sessions. And I have to say, with all honesty, closing a shelter is really not a strategy that anyone is undertaking. I think we made our point. by letting the government know that there was a high-risk situation here because we were very dissatisfied with the rate of speed and the results that were happening for our community. But completely disenfranchising people is not the right thing to do. And I think when I look at the letters, you know, everyone interprets things in different ways and you take what you want, but I just can't believe that our community would want that as an endpoint to completely disenfranchise people. You know, it's not going to solve the problem. It's not going to make it better, I don't believe. I think we have to get behind a problem that has been thrust upon us as a municipality that we're never prepared to take on at this level. We don't have the resources. So how do we get resources for this? We keep strong partnerships with Interior Health. We keep strong partnerships with the provincial government. We keep strong partnerships with our service providers, with the RCMP, with BC Housing. They are the ones that have the funds and the resources to help us with this. And I've had talks with business owners too, and a lot of their concern is no one's getting better. No one seems to be getting better. I wouldn't mind it if I could see there being improvement. So I think collectively, let's work for improvement on this. Let's work for stabilization. Let's bring in more resources and let's get the help we need. You know, let's stabilize this shelter. Let's look at operations if we need to make sure that there's a comprehensive care plan. Let's provide feedback on a regular basis to our network of support here so that we can identify people at risk. And let's keep the lines of communication open with our funders and with our community, because that's our only option that we have. If we shut this, we are on our own. The City of Trail is on our own. We will not have the support of BC Housing. We will not have the support of the shelter, and health services will be clawed back. So, and we are also going to lose the 2 outreach workers that we just got funding for through the provincial government. So I really am proud of council. This has been all encompassing. You know, I think last year when we set this for a year of a permit, I think in our heart of hearts, we felt, you know, we're almost there. We've been working for so long. We've been working for 2.5, 3 years with BC Housing on supportive housing, and we're almost there. You know, we're going to have a place, we're going to get it done, and we're going to help to really fix this. And we were talking about, wouldn't it be great if we could get to the end of our collective terms and say, look at the success that we had. And unfortunately, it hasn't panned out for lots of reasons. But, you know, this is our opportunity to do the right thing, I believe, and move that needle and get enhanced supports and stabilize the vulnerable people. And so I'll leave it at that. You know, we can at this point open it up for public questions. I know I had one question here was, what is the plan for supportive housing? Does BC Housing have any input on their intention or their commitment to supportive housing to continue to work with us? That was one that I just had come through email.
Okay, so before we start the opening of that, I would just like to respond to everything you said. And you've given very comprehensive overview of the whole situation. And I thank the 4 people that made a difference when they went down to UBCM, because that obviously was what finally cracked the egg open, so to speak. I hope that the words that you have said today are going to be some comfort to those citizens who do not want the shelter to continue, and also some comfort to those businesses that are continuing to experience all the side, I guess, the feed off of the downtown shelter and all the problems that go with it that affect the businesses, because this is the other side of the coin. And we cannot forget about those people and those businesses that are paying the cost, both in loss of businesses and trying to get employees to work for them. And in one cases, I have spoken before, where 5 businesses have spent close to $100,000 in trying to maintain their businesses so they can be operational and keep themselves safe and the community safe. So thank you for that, Mayor Payson.
You're welcome. Council, what would you like to do? I mean, CAO McClure, do we want to do a little bit of a public question period here? I don't know if there's a need to speak from the audience anymore after what we've heard. Oh, you're on mute. We can't hear you.
I said, we made those that have joined us today that a possibility. I think that we also asked, and they've been patient and quiet here listening to all of the information. And maybe that's answered many of their questions, I'm hoping. But I think that because we committed to allowing those that don't have a beef about what's happening here, but if they have a legitimate question about this, I think that council should entertain listening to that.
Oops, sorry. If that's the case, then I think what I'll do is I'm just going to duck out for a bio break, but I'll just let you manage the room because it's easier for you so you can see the people who are coming up. If you don't mind, I'll mute myself. And if anyone wants to come up to the microphone, you're the boss. So I'll just be back in a minute, but please continue with.
This is a big joke.
It's not important.
Okay, is there anyone that would like to address again?
I have a question.
You have, yeah, maybe you want to come to the podium. And do you know, just maybe state your name? And,
Yep.
yeah, and if you have a question, is it to a particular group, BC Housing, IH, council?
My name's Dave McKay. I live in West Trail now. My question is to Sheila Adcock. My son is down at a shelter. He's been kicked out of his mother's house for the 4th time. I can't bring him into my house. And all he wants to do is smoke marijuana and drink. Are you following up on this? Because I think that's unfair to people, especially the businesses in town that have help wanted signs and they can't find anybody. I'd just like to know if you do follow up. That would be appreciated. I thank you very much for your time.
Okay, it wasn't kind of a question I was expecting, but I don't know, you know, if someone was at the shelter, then is no longer allowed in the shelter. I'm thinking it's not something that you likely follow what they're doing.
I can't comment on anybody indirectly or any family member. I couldn't really comment on anybody due to privacy, but any individual that is not allowed in the shelter due to behaviors are still offered food and hooked up with resources in the community. So.
Thank you. Is there anyone else that has a question? I'll ask again, is there anyone in the gallery or otherwise that has a question? You're coming to the hill, yep. And your name, sir?
John Delio, the Agriculture.
Go ahead.
Yeah, I was wondering, like, on most of the circumstances, it's cost a lot of money for a shelter, I would imagine. But there's a lot of people that have an overextended amount of money. Like, there's no way you could spend, say, $1 zillion in, say, 70, 80 years of your life. It's hard. But if you had, like, where they gave a person, like you're shoveling a driveway, $100 an hour. If it takes you 3 hours, I'll give you $400 an hour. And, you know, they do that, of course. And then pretty soon everybody's living equality and they don't see any sense in, you know, finding another thing that's going to make that day just, you know, awesome. Like, try this stuff, you drink a bottle of wine, anything's okay. You do a little bit or whatever when you're done. But if it's like that, you're going to see people working, you know, 17, 18 hours a day. They won't. Everybody's living in a high-end built house, and we've got the best of everything. And there's no loss of people if they can make things with their hands that is basically beyond what a person would think that they would do that. They would make it, and then there'd be other people that would come that had something that you wouldn't think could ever be made out of a piece of glass, but they can hold it and it gets warm and then just make it like a glove. But I'll tell you, it's either that or it's that. $80,000, $60,000, $90,000 a month. Yeah.
Thank you, John, appreciate that. Is there anyone else? Yes, ma'am.
Hi, Tia Hansen, 3461 Marigold Drive and Trail. Also representative of the Downtown Trail Improvement Committee. Question, just to clarify for those who may or may not have been listening, has a site been identified? That is a question that I think everybody needs to be very clear, that it's not a hope and a wish and a dream, that there is a plan. The other question I have is for Sheila and the shelter. Is there a policy in place when care is needed, who is called and how that is administered? Is it dependent on who is running the shelter at that time? Or is there a policy in place that BC Housing has identified if someone comes in and is in need of care, who determines what kind of care is needed? What kind of outreach, etc.?
Okay, thank you for that. On the quick answer, there have been a couple of locations that have been looked at, and there just needs to be, again, is there connection to water, sewer, those sorts of pieces. So yes, we have some. And again, as BC Housing saying, there's a few other regulatory pieces that we need to work through on approval on that side. Yeah. And again, Trail Community, did you have a response to who decides on from that question that you heard from? Yeah.
So individuals that show up at the shelter, our role is to provide food, shelter, clothing, showers, that kind of thing. The outreach team are the ones that hook them up with, assist them with connecting with mental health, connecting with other resources, anchors, different other resources in the community, as well as our Getting to Home program, which helps people find housing. And going to one of the questions earlier, in the past 3 months, we have found housing for 5 individuals that have history of being struggling with homelessness in the community, are now housed and continue to be housed. So, you know, we work together with the local Getting to Home, which is a homeless program, with Interior Health, with the different food banks. So when we help people get set up so that they can be successful in maintaining their house. So the immediate need when people come to the shelter, our goal is to assist them for a place to sleep, eat, and get well. If there's emergency issues, we have had in the past 4 times we've called ambulances to the shelter. They have been for 2 heart attacks. One is an 80-year-old woman with a broken hip. There's 2 others that have heart attacks. There have been no ODs called to the shelter. It's all heart and physical health, because if you look at that many people, there's a lot of physical stuff going on too. So we call the ambulance as needed, and we contact urgent response if needed, or the RCMP. So it just depends.
Hi, Marty Macklin. A lot of you have said, well, first of all, it's disappointing that you're not here in person. It's really disappointing. More resources are needed, but how much is being spent on this whole, the shelter, you know, the ambulance is being called, the paramedics, all that stuff, how much is being spent now? You know, mental health, how much money is being spent right now overall, and how much does the city give, you know, the different partners that are involved, how much money in total? I don't know who can answer that. Somebody.
I would make a stab at it. Difficult one, the housing, so BC Housing, so the shelter itself is funded through BC Housing. So that is not something that is running through the city, but it is our tax.
Right, yeah, right,
Yeah. But that's not a question that I have, or not something that BC Housing sort of has, you know, a public, like, hey, we're spending this much at this shelter sort of thing. That's not information that they provide, but they are the ones that are providing that funding for the shelter.
BC Housing, but is that a public document available?
No, that's what I'm saying to you. There would be no public document that would say, this is how much funding is going to this particular shelter. They would say, we collect funding for, these months of dollars, and we get that information, and it's going out to support all kinds of different initiatives, but there wouldn't be something that would say, oh, yes, we're going to tell you what dollar amount is going into the shelter. We don't have that. And that's not something, well, again, that's government, right? And we're government too, but it's not.
Yeah, but I
something
thought all
that
government programs were that you could access them online, and I haven't been able to find that.
Yeah, I don't think on that operational side of what grant is going for what particular shelter, I think that would be something.
Oh,
we should
Sheila knows that. Sheila, does Sheila know?
Yeah. Well, I mean, again, she may, that's, again, you asked me on that question, I don't know.
Whoever can answer it, I'll be happy to hear the answer.
But the other side of what you're saying is that as far as tax dollars go, I mean, obviously, the city commits to and pays for our CMP. So again, we're paying for that anyway, but if they're not, doing traffic because they're dealing with, other situations, we're paying for those dollars anyway. It's just, is it allocated in the way that the community would want, or is it beneficial as it can be,
So is that the only money that the city gives is through RCMP or?
Well, just saying, we fund a portion of the RCMP.
Okay.
Again, when you're talking about IH and their model of providing whatever resources they have, again, that would be tax dollars that would go on health, and then it would be distributed out from there. So again, as a quantifiable number, I could not, and I don't believe anyone could actually give you that.
So we have no clue, in other words, how much is already being spent, but they're asking.
Point of order, Your Worship. We need somebody to chair the meeting. It's not fair to Colin that he is dealing with this.
Yeah,
And if someone's going to speak, they need to come to the podium. This isn't a forum for people to debate across tables. So I'll be more than happy to chair it if you feel uncomfortable chairing this, but we need some proper protocol. And it's not fair to Colin to.
No, I'm fine with chairing, and thank you for that. I mean, it was orderly until just this minute ago. And I think, let me just wrap up this section on costing, is that the public agencies disclose what they are able to disclose. And we don't have a number, but what I can say about funding right now is that, clearly it's not enough. Clearly we need more. And that's, as a community, what we are going for, but it's an interagency approach where we are all coming together with resources. So I think there's someone I can see at the microphone. If you want to approach the mic and say your name and address, please.
Yeah, for sure. So my question is for BC Housing, and my name is Roro. Do we think that there will be a solution within the year? And then also, I would like to propose that, or just to highlight that the atmosphere is very disgusting. I think that some of you all who are here should have a little bit more empathy. People who, yes, have a little bit more empathy. The people that you see on the street aren't the only people that are using drugs. That is probably 10% of the people who uses drugs and are using mental health resources. Those people that are using drugs that you are seeing are the ones that are most vulnerable. If we go to trades, we know that those people are most impacted by with drug use and drug use disorders. You guys need to be more empathetic. Those counts.
Okay, just hang on. I'm just going to interrupt here. So the point of public question period is for the people who are speaking to address council. It's not a back and forth with the audience, please. So if you can please address council, make a statement, and if you have any questions, but this is also not a back and forth necessarily on questions to that extent. So if we can just keep it a little bit focused where you're addressing council, that would be helpful. Thank you.
Yeah, my apologies. So the
That's
question,
okay.
This question was BC Housing.
Yeah.
Are you confident that you can get this completed in a year?
Go ahead, Tyler.
Yep, I can speak to that. We've delivered a number of temporary modular shelters, such as the one we're proposing for Trail, within a 1-year time frame. So yes, we're confident that we can deliver it. As I said in the presentation, though, there are a number of steps for that to happen, including going through a municipal approvals process. So there's still, somebody else asked if the site has, if we have a site secured, there's still a ways to go before we could say confidently that this is, 100% guaranteed. So we will try our best. And like I said, we have delivered them in less time in the past.
Thank you, Tyler. Okay, so.
We have a lady coming to the.
Okay.
Thank you. Hi, Tony Dreedy, and my question is to Sheila. Is the shelter open all day to these people, or are you just opening up the beds in the evening for the 18 beds that you're opening? Do these people have access to the shelter during the day?
Yes, the shelter's open 24 hours a day. And people are coming for food and clothing in and out during the day. Yeah, we're open 24 hours.
Okay, because someone had mentioned to me saying that it wasn't. So do they have access to a washroom in there?
Yes.
Okay, thank you. Also, my second question is that you have 18 beds and you report that you have, is it 32 or 35 that are homeless? What do you do with to the ones that are not able to go into the shelter?
We serve 37. Some of them don't sleep there at night. They come during the day. They might be sleeping in tents or in somebody's couch and have to leave during the day, or on a porch, but they're virtually homeless. They have no place to be and no food. So some will come during the day and just have showers and eat, but are literally homeless. So others, there's about 18 or so that actually sleep and use the sleeping services at night.
Okay, thank you.
Okay, so Colin, is there anyone else in the room that would like to speak? If not, I think we can safely go to motion here.
We've got one more that's stepping up.
Sorry. Ravi Ganda, 8327 Highway 3B. My question is to Sheila. So with all these people, like before we make a decision on extending the shelter for another year, can you provide us any statistics of how many of these people that have come through your door and actually become like a part of society and helped us with, like, that are working and contributing into society?
I can't pull up statistics over the past year, but I can say that there are a lot. Like I said, we just did get these individuals housed, but we also have programs. We have a peers program that is an employment program that hires individuals that are homeless at the shelter. And we had 22 come through that program last year. Of those, 12 of those went into the OAT program and started the process of looking for treatment and or supporting their road to recovery. So they have made huge leaps and bounds in their progress by getting out, working in the community. They've been doing all kinds of stuff. They work for Communities in Bloom. They help clean up around the area and have done a lot of painting, window washing for the businesses around the shelter. So they've done a lot of work, been paid a wage, and have made huge progress with their some of the issues that they've had a lifelong time dealing with. So yeah, there's been a lot of, and we see, I guess that's where we see and we measure the baby steps and watch people grow and make changes and make better decisions. So it's been great. So yeah.
Okay, thank you.
Okay, council, does anyone have any other questions for our main agencies here?
We have one more coming to the.
Okay.
Sorry. My name is Ryan Buckley, 408 Buckner Street. I had some thoughts that I had written out, and this seems to be more of just a direct questioning. Is there another form by which I can share those thoughts, or have I missed my window for submitting them?
Was this in your hopes of on the decision or just on going forward?
On the decision, I was voicing support.
The question's going to come here pretty quick, so I don't know if we can solve any of that now.
No worries. So missed my window. Thank you.
Thank you.
Can I just ask one question?
Yes, go ahead, Councillor Santori.
Of Sheila. Sheila, just so for the public's sake, is it fair to say that, we talk, the ones that are causing the major problem and concern within the community are not people that are cleaning up at Jarrow Park, and they're not the ones helping in community improvement. Is it fair to say that there is a segment of those three people that, number one, will be very difficult, if not impossible, to get them out of their drug addiction? Some are unemployable, and some are, you can't house them because a landlord's not going to want them, especially when you don't want them.
I will tell you that 50% of the calls we get to go do cleanup in the community are for individuals that are housed.
Correct.
So they are not homeless shelter guests. We get called to staircases around trail. The outreach team will go and encourage people to move on, but we can identify that most of the majority of those individuals are not homeless and accessing services at the shelter. They're housed, but choosing to congregate in the community. That might go down as winter hits. I mean, it's summer and people are hanging out in the parks and stuff, but I can say the majority of the ones that we go to clean up for are not shelter guests.
Right. So, I mean, this is just so that people don't get a sour taste for career development services. There's an assumption that it's the people that you're taking care of that are causing the problem. So just so the public can differentiate between those that are living in our community with unacceptable behavior and the ones that are causing the problems for our community. So just so that the members of the gallery and people watching understand that there may be one or two troublemakers that you are housing, but the vast majority of them, you're not a part of their lives other than giving them meals.
A couple.
Okay, I'm going to go to the room right now, and Brenton Raby, if you would like to address council. And we can't hear you. Nope, I still can't hear you.
No.
It's his audio.
Is there another one to go?
Well, she hasn't come, she was
Okay.
asked to come in, but she didn't come in.
Okay, so council, do you have any more questions right now? Okay, so we've got a motion on the table. It's a three-part motion. I'm going to read it. That council take into account the update from BC Housing, Interior Health, Trail Association for Community Living, and the public input received. Consider the renewal of the temporary use permit to allow the expansion of the homeless shelter that operates within the premises at 1856 Bay Avenue for 1 year. That council requests an update from BC Housing by October 31st, 2022 of their commitment to an approved life safety plan for the La Nina shelter by the regional fire chief. And that council requests an update from BC Housing by October 31st, 2022 on their commitment to provide 8 a.m. to 8 p.m. daily security at La Nina shelter. If there's no questions from council, do I have someone to make that motion? Councillor Butler, there's a question.
Has BC Housing agreed to these terms?
You're shaking your head and nodding affirmatively, Tyler?
Yeah. We reviewed them in advance.
I'll move it.
Sorry, so I have Councillor Butler making the motion. Did someone second that? There was a,
Seconded, yeah.
thank you, Councillor Kashoni. Is there any other questions or comments on this matter? Okay, we're going to go for a vote, and I need all the hands up, please, and can you just hold them up? All in favor? Against, if any? Councillor Santori, I'm not sure what your hand did there.
Well, for all those that I responded to, which were probably hundreds, I said I would not support this. But given the information that I've received since I've made those statements, and I apologize to you if you feel that I am going contrary to what I responded, there's been new information that is brought forward to me that gives me a level of satisfaction that I didn't have before. I'm hoping that with the increased security and based on the communication that's been taking place, that over the next year, we will see significant improvement downtown. And I'm going to support this motion, despite the fact that some people that spoke think some people lack compassion. I am actually supporting this for those that are being housed and those seniors and people with mental illness that actually need the help. And I don't want to take away from them because of the few that are, quite frankly, not welcomed in our community. And we can't judge those that truly need the help strictly by the ones that are causing the problems. And it should not come at the expense of those people that are actually need the help, and many of them that are trying to seek help in employment. So for that reason, I will support this motion for 1 year.
Okay, thank you. And sorry, I didn't mean to put you on the spot there. I just didn't see your hand. So I needed confirmation on this.
Give me an opportunity to babble some more.
Okay, so it was 5-1. So I just want to, before we close here, we're going to have to get Councillor Gattafoni back into the room. The council is moving on to other business. So we're just going to take a 5-minute break so that everyone can leave if you want to leave.
To do that, since I'm the only no vote, I would like to have the option to be able to speak to it, please. I think that's fair. It's a difficult, very, very difficult situation for me in terms of vote, but because the last 15 years I have been working so closely with the businesses and supporting them and listening to their cares and their worries and their concerns. My vote is simply to stand again with the local businesses in terms of their position and what they're having to deal with in the downtown core. I have no doubt with the majority of votes that have gone through that we will move ahead as progressively as we possibly can, and we will get the right answers and the right solutions to this problem. I indicated earlier that I have supported the homelessness in this community in many, many ways. For 5 months last year, I toured this town 3 to 5 evenings a week, checking on the homelessness, at times taking coffee down in the colder weather. I have worked at the cooling center. I have supported the food bank. I have visited the facilities in Nelson.
Point of order.
Yeah, honestly, we're not campaigning here.
Yeah.
In all fairness. So I think your point was made, and thank you, Councillor Dobie. And I think we're gonna move on here. We need to get Councillor Gattafoni back. So if we've been here for almost 2 hours, if someone wants to take a bit of a break, maybe we'll just take 5 minutes and then come back. Councillor Santori, is there order?
Yeah, Lisa, just for the record, I think that unless I didn't hear the reason for Councillor Gattafoni Robinson, but for the record, it should be stated that she was not there because of a potential conflict.
Okay, great. Let's reconvene the meeting. We are in or on 3.2 unsightly premises, 798 Short Street. And Ms. Lucchini, you are taking this agenda item.
Thank you, Your Worship. The property owner at 798 Short Street has been requested to remove an accumulation of discarded materials and tarps that are strewn around the property. Photographs are concluded in council's reporting. It is recommended that council issue an order requiring the owner to remove the materials, and council may want to consider a shorter period for compliance within the resolution, given that this matter has been before you on numerous occasions prior and is a continuing problem for the neighborhood. Yes, it's also being reported that the property is a place where the vulnerable population are allowed to shelter. And therefore it's being requested that the tarping material that they've been using to tarp around the deck and the carport area, backyard area be removed. It is in addition to it not complying with the zoning bylaw in terms of what a fence is, it's also unsightly. So before you is a resolution recommending that pursuant to the provisions of the unsightly premises bylaw number 2669, 2008, it is hereby resolved that the owner of lots 12 and 13, block 51, plan NEP 465D, DL 230 Kootenay District be notified to remove the accumulation of discarded materials, namely tarps, bamboo blinds, cardboard, bicycle parts, broken wooden furniture, discarded items, plastic containers full of discarded items, plastic bags, and other debris within 14 days of receipt of the notice to do so. And be it further resolved that the corporate administrator of the City of Trail be authorized, in default of the action being undertaken by the owner within 14 days of the notice to do so, to carry out and have such work carried out and the expense charged back to the owner. If unpaid on December 31st, the expense shall be added to and form part of the taxes payable on the property as taxes in arrears.
Okay, Councillor Santori moving it, and do I have
Second,
someone to
Robert.
second this? Councillor
Second, Robert.
Kashoni, thank you very much. Any comments or questions on this repeat property that's come before us?
Only that it's been before us, this council, and I believe Sandy, you can confirm that this was before us with the previous council as well.
That's correct.
Well,
Okay, any other questions or comments on this item? Seeing none, all in favor? Against, if any? Carried. Carol, I can't really see what's going on there. You've got something in front of your screen, and I'm not sure if it's your hand or if it's something pink, but just to let you know that.
I don't know what it is either, because there's nothing.
Okay.
Crazy. I'm sorry.
Can you just maybe move your camera a little bit? I just can't see you. Or maybe if you try to move to your right. Let's just try that a little bit.
I'm going around in a circle here and nothing's happening.
Okay, you might be just a little bit stalled, actually. It might come forward.
I've stalled all my life.
Okay, so Councillor Kashoni has signed off. He says he's not feeling very well, so we're going to carry on. There's two proclamations. Circular Economy Month, which is the month of October, and Lung Cancer Awareness Month, which is the month of November. The recommendation is that Council proclaim October 1st to 31st, 2022 as Circular Economy Month, and November 22nd as Lung Cancer Awareness, or November 2022 is Lung Cancer Awareness Month in the City of Trail. Do I have someone to make that motion? Councillor Gattafoni Robinson, thank you. Do I have someone to second that? Councillor Butler. Is there any comments or questions on this matter? Seeing none, all in favor? Against, if any? Okay. Councillor Dobie, because I can't see you, I would just suggest, I can hear you, so I would just suggest that if you are going to vote for or against, you just say for or against so that I can hear, or just against, and I'll assume that you're for if you don't say anything.
No, I
Okay.
just did. I said, yeah. Okay,
Yeah.
thanks.
Yeah, you're very welcome. So I'll just listen for that. Okay, so council committee reports. Councillor Gattafoni Robinson, you're up first. Do you have anything to report?
I have nothing to report, Your Worship.
Okay, great. Thanks very much. Councillor Santori. Going to give us the GOC report? And you're on mute too.
I got it. Okay, brief report on the GOC meeting that was held earlier this afternoon. Some approvals from council with respect to first Parks and Recreation. A contract has been awarded for the pickup area unit, which serves for the refrigeration plant. It's a key piece, integral piece of the equipment for the refrigeration plant. And without it, we would have no ice over the winter time. So the low bidder was Venture Mechanical Systems in the amount of $93,223. There are some other incidentals that have arisen. Our original budget was at $100,000. The request was to increase our budget up to $116,000. And staff has reported that other capital projects that are being suspended or postponed that weren't deemed to be of higher priority will make up the difference of that $16,000 as we proceed with this higher priority capital project. And that was approved by council. And there were 4 bids. And as I said, Venture Mechanical, who has experience and have worked with the city and the facility before, has been awarded the contract. Next is the purchase of the 2022 hybrid pickup, the first of a fleet for the City of Trail of going to hybrid and to moving towards more of a green and environmentally friendly fleet. So that is being The recommendation there and supported by council was to buy the new Ford 1500 series 4x4 pickup, and the successful bidder was AM Ford in the amount of $68,014 plus applicable taxes, fees, and charges. Item 2.2 under Public Works, the Cambridge Creek and Rattling Lake Ecosystem Restoration Project. It's a heavy equipment contract, and council approved the expenditure of $77,500 plus applicable taxes and fees. And the successful bidder there was Silverton Transport Limited. Next is item 2.3, 1500 block of Cedar Avenue, which is across from Selkirk College. There was a retaining wall that is starting to deteriorate. However, after reevaluating it, it has been deemed a lower priority than other capital projects and will be suspended in 2023. And also with the hope that the inflation rate and cost of materials and equipment, we will start to experience some reductions in our capital projects moving forward, because in all likelihood, most of them will exceed budget strictly due to the supply chain issues and the inflationary cost associated with it. And next, which is something positive that is back on the agenda and hopefully will come back in May of next year. And I hope that the new council will act on this immediately, because having been involved with Silver City Days, it does takes a lot of planning. I'm sure Colleen and Carol can attest to the amount of work that goes into putting on a successful event. So Silver City Days has now, or the City of Trail has now approved a 3-year contract with Shooting Star Amusements, who were the providers of the Midway prior to COVID. We changed over to them probably about 7 or 8 years ago, and we have found them to be extremely professional, very clean, and the compensation package offered by them to the city was very attractive in comparison to what we were getting before. So council has approved entering into that contract with Shooting Star. And I'm sure the community is looking forward to celebrating something come May, especially with hopefully the tail end of COVID and all the other issues that we as a community and a country have been faced with over the last couple of years. Moving on to grants and aids, there was 4 requests. First was the Trail and District Chamber of Commerce have asked to waive the rental fee in the amount of $349, and that is for the Trail Memorial Center Gymnasium for all of the municipal candidates forums that will take place. So it's either waive the rentals or go to the candidates, and you guys can all chip in so you can speak that night. But the city will pick up the tab for you, and that was approved by council. Next was Greater Trail Minor Hockey Association, a request for a rental waiver as well. That was approved by council. And last was a rental request from the Columbia Basin Alliance for Literacy. And that was approved by council. And that concludes my report on the GOC. And I believe that this is our last official public council meeting, or do we have one more?
2 more.
2 more.
In October.
Awesome. Okay. Thank you.
Any questions of Councillor Santori? So Councillor Santori, I'm just gonna put a little bug in your ear. Remember when we switched over and Keith Smythe became the person who started organizing Silver City Days? In your retirement as an elected official, just keep it in your mind that maybe you want to come back and volunteer and be our Silver City Days guy in some part or in full and help the city, because you have experience. So we might come knocking at your door.
Well, I'll talk to the new council when the time comes and
see if they want you.
Yeah, they may not want me.
All right, Councillor Jones.
I will definitely consider it. It was a lot of fun doing it.
Yeah, and you did a great job. Thank you. Councillor Jones, you're up.
Thank you, Mayor Payson. You know what? I really don't have a lot to report because I've already spoken about the UBCM and the good work that we did down there. We already spoke about answering all the emails and letters and phone calls that we have. I wanted to talk about the Silver City Days. because that's exciting to get the rides back and know that we're officially planning it. So everything's already been said. Thank you.
Okay, great. Councillor Butler, go for it.
Yeah, I'll just simply ditto that. I think there's been a lot been said, but it was a very good week at the UBCM, and I'm very proud of the Trails delegation that was there. Thank you, Your Worship.
Thank you, Councillor Doby.
Okay, can you hear me?
We can hear you.
Okay, I'm sorry that you can't see me. You've probably seen enough of me tonight anyway. Okay, so I have a couple of things to cover off here, and one is to do with the SPCS community. And I think I mentioned at the last meeting that they were in support of some of the changes that the residents of the Silver City Gardens have had to face. And it was mentioned to us that there was a couple of sister operations similar to this, one in Cranbrook and one in Nelson, and supposedly one in Castlegar. I have been communicating rather with sorry, it's been a long night. Cranbrook, not Castlegar. I have been communicating with Cranbrook and so far cannot find a sister operation. But we are working on putting a letter together, and hopefully that'll be done within the next couple of weeks, asking some more questions and basically expressing some of the concerns of the residents there. Approximately 75% of them have been very upset as to what's happened and the loss of the services that have been taken away. The other thing under the SPCS committee is there was 2 benches at the hospital that I believe were really open to the inclement weather, and they had been working on getting covers for those benches. Mayor Payson, you may know a little bit more about this at the hospital yourself, but I understand that the covers are now completed. And so during the inclement weather, when people are waiting for buses or just waiting for rides, that they won't have to be out in the rain and the snow. The third thing on the SPCS committee is for those people that are interested, our annual general committee meeting is October the 15th. And unfortunately, at this point in time, I think it's at the Legion. That has been confirmed. But if it changes, I will announce that, or we'll get something out in the paper. But right now it's October the 15th at the Legion, and it will probably be in the afternoon. The time has not been indicated as well. I wanted to report on the garden, or pardon me, on the markets. I believe our summer has been very, very successful. We have 2 Christmas markets coming up in December, and I believe they're a week apart, and I think they're the 10th and the 17th. I just can't find all my minutes on that, I'm sorry. And I believe there's going to be a market for Oktoberfest as well. So we've got some, well, I guess 3 really prominent markets that are going to showcase some different events. The ones for Christmas, the vendors are full already for both of them. We've been getting requests as far away as Vancouver Island and up north, Prince George. And to date, I think we've got 85 vendors, and I don't know if we have room for any more. So already they're sold out, and it looks like they're going to be a success. So those conclude my reports. Thank you, Mayor Payson.
Thank you. Any questions for Councillor Doby? No. Okay. I've got a bit of a report, but I'll try to go quickly here because I know it's been long for everyone. So the first item I attended was a Tech Trail Health and Environment Committee orientation session with our CAO, which helped him learn more about how Tech and the Trail Health and Environment Program operate in Trail. Attended a Trail Community Action Team meeting and just continued discussions on supports needed for the underhoused and the vulnerable population. I just want to acknowledge the Trail CAP for their purple chairs that they positioned in downtown Trail on August 31st to recognize International Overdose Awareness Day. Very quick recap of the UBCM because it has been on social media pages, but it was a very busy and productive week. We had 8 meetings as a city delegation with ministers and staff, and they were very, very productive across the board. The ministers were really briefed well and ready to receive us, and we always come prepared, so that makes a big difference. I also attended the Highway 3 Mayor's Coalition meeting, and as the acting chair of the West Kootenay Boundary Regional Hospital District, I presented to Minister Dix on what we need for support of rural healthcare, including advocating for a new MRI at KBRH. There was lots of seminars on housing solutions, decriminalization, harm reduction, local solutions for homelessness, and the local government's role in the mental health crisis. So if one wanted to go to the UBCM and see what best practices were and how people are doing things in their town and gleaning a couple ideas and learning more, it definitely is, it was the place to be. And there was a lot of other sessions as well that I believe other counselors went to. I just chose these ones to go through because it seemed to be the most pressing item in our town. And we did attend the final address by Premier Horgan to UBCM delegates, which was very inspirational. More recently, with the Trail Health and Environment Committee, that meeting was this week. They presented a refreshed strategic directions document that was approved. In the coming months, they're going to be completing all the sampling from the yards and all the yard remediations. The blood lead clinic is happening right now, and then the blood lead results are going to be presented in the fall at the very beginning of December. So that's always a nice way for us to kind of wrap up our year of programming to see how what the success rate looks like. I also attended an Interior Health Mayors and Regional District Chairs meeting, and they talked about the COVID-19 booster campaign that's underway. So I just ask that you watch for your prompt to book an appointment. That comes through either email or generally text if that's what you signed up for. They spoke about the global healthcare workers shortage and investing in both recruitment and retention initiatives to try to retain and get more employees. I presented the Mayor's Choice Award to Sandra Irving for her painting called Moraine Lake Magic at the Visac opening reception, which was just this Friday night. And it was the first opening since COVID that they did, and it was really well attended, and it was a lovely evening until I kicked over a wine glass on the floor, and that went all over the place. But it wasn't my wine glass, it was just an accident, but it was a nice event that we went to. I attended the market this weekend, which was just a glorious day. And I'm just so proud of the work that the market team has done. It was just well attended. It was lovely. And what a great resource for food coupons for people who need it, and some great opportunities for shopping and supporting local. And just a reminder to everyone, September 30th, which is this Friday, is National Day for Truth and Reconciliation and Orange Shirt Day, 11 to 3 at Jubilee Park behind the Riverfront Center. We are having a community event. So please, everyone, come down if you are interested. Some people have the day off, some people don't, but come down on your lunch hour and enjoy the festivities down there. Does anyone have any questions for me?
And September 30th is the home opener for the Trail Smoke Eaters as well. Just thought I'd
Thank
get
you.
that in.
Yeah, thanks very much. It's appreciated. Lots going on. All right. Number 5 is consent agenda. So there's report on invoices paid for municipal services August 1st to 31st, and the recommendation is that the consent agenda be received for information. Do I have someone to make that motion? Councillor Jones and Councillor Butler moved and seconded. Any questions or comments on this? Seeing none, all in favor? Against, if any? Carried. Thank you. Any new business from the floor? No? CIO McClure? Sure. Take yourself off mute.
Okay. So you can hear me. So just a few things. One, just wanted to remind the public that are watching, it's sort of dropped off since the early part of the meeting, but we've got an all candidates meeting coming up. Not we do, but just that there's an opportunity to get out there. September 29th there coming up at the Warren Center, and it's open doors from 6:30, 7 o'clock is when it's supposed to start, a couple hours. It's an opportunity for the community to meet those that are running for mayor and council. Also, just really wanted to do a shout out. He's sort of a private guy, but a face of the city. We don't do this for everybody, but Dave Rowe, 34 years at the city, is retiring. This will be his last week. So pretty fantastic. And I just, I've only briefly met him, but I've heard such great things. We know that the Smoke Eaters are also going to honor him, hopefully tonight on September 30th, I believe. And just again, a real thank you to him, and to stay at one employer for that long and to give that much of your life to an organization. It's something to be proud of. He's a very modest fellow, but I appreciate us recognizing him. But I thought it would be important for council. Many of you have been on council for a long time and know him. And so just one of those changes of the guard, I should say. The last one's not necessarily new business, but I just wanted to give an update. I know that the public's wondering what's going on with Butler Park. Our understanding is that Norwest will be mobilizing on the site either the end of this week or next week. So we should start seeing some activity there, and hopefully that'll mean that you'll get less phone calls. So, and that the work will get started. So that was all, Mayor Mason. Thank you.
Great, thank you. Okay, 7, 1, 2, and 3 are department reports. RDKB Building Department, July 2022, RDKB Building Department, August 2022, and Bylaw Enforcement of August 2022. The recommendation is that these reports be received for information. Anyone willing to make that motion?
So moved.
I'll go Councillor Santori and Councillor Jones first and second. Any questions on these reports? Seeing none, all in favor? Against, if any? Carried.
Yes.
Oh, okay, thank you.
In favor, sorry.
Yep, got it. No, got it. Thank you. All right, that's it for the agenda. I'll call for adjournment 8:27. Do I have someone to move adjournment, please?
So moved.